President Cyril Ramaphosa is about to open the launch of the 2020 report of the UN Secretary-General's Independent Accountability Panel for Every Woman and Child. It does focus on COVID-19 and the impact on women and children. Let's go live now to that virtual launch.
Poor healthcare capacity and pre-existing disease burdens. The pandemic is placing an additional burden on already constrained health systems. This global crisis has starkly highlighted the value of universal health coverage in responding to health emergencies and the need for robust health systems to save lives. South Africa fully supports the efforts of the World Health Organization to ensure that there is universal health coverage across the world. The reality that we must now confront is that the response to COVID-19 crisis has required countries to reprioritize the allocation of their resources by diverting crucial technical and financial resources from other critical areas. The health of women has been severely impacted through this reallocation, particularly in sexual and reproductive health services. There is a real danger that this will contribute to a rise in maternal and newborn mortalities, increased unmet need for contraception, and an unprecedented number of unsafe abortions and sexually transmitted infections. South Africa believes sexual and reproductive health services are crucial for a thriving society, including access to maternal health care and interventions related to gender-based violence. As countries of the world, we must ensure this pandemic does not worsen existing inequalities in society or impede the realization of the rights of women and girls. We must ensure that our response enables young people, in particular, to shape the world that will emerge from this crisis. It is significant that 65 out of the 168 Sustainable Development Goal targets refer to young people explicitly or implicitly, with a focus on their empowerment, their participation, and indeed their well-being. It is our desire that developing countries should have equitable access to safe and effective medicines and new health technologies as well. We call on the world to undertake the actions that are urgently needed to ensure collaboration on the development of knowledge, intellectual property, and data for existing and new therapeutics, vaccines, and diagnostics for COVID-19. I would like to commend governments around the world for their collaborative efforts towards advancing Sustainable Development Goal 3 on ensuring health and well-being for all. This includes a bold commitment to end HIV and AIDS, tuberculosis, malaria, and other communicable diseases by 2030. Fighting this global pandemic requires all of us to work together in collaboration with the United Nations as a united force. Indeed, we are stronger when we work together. I wish this meeting success with its deliberations. I thank you.
Thank you very much indeed, His Excellency, for your comments, for your call to arms, and also for your leadership in this area. And now I'd like to call on Mr. Shinchi Kataoka.
All right, that's officially the launch then, of course, of that IAP report. That is then, of course, then, so certainly interesting on that front.